Muscular dystrophy. How do respiratory muscles compensate? Imagine your body trying to keep up with a slow but steady decline in muscle strength. That's what happens in muscular dystrophy, especially when it comes to breathing muscles. As these muscles weaken over time, the body doesn't just give up. Instead, it activates clever ways to help maintain breathing. One way the body compensates is by making each breath count more. The brain sends stronger signals to the remaining healthy muscles, causing them to work harder. For example, in Duchenne Muscular Dystrophy, patients often breathe in more deeply by prolonging the time they spend inhaling. This means they take larger breaths by increasing the airflow and making the inhalation last a bit longer. Even though the muscles are weaker, the nervous system adapts to maximize their effort. The muscles between the ribs, called intercostal muscles, also step in to help. These muscles stabilize the chest and assist with inhalation. When the diaphragm, the main breathing muscle, weakens, these accessory muscles work harder to keep the chest expanded and air flowing into the lungs. They help prevent the chest from collapsing inward during breathing, supporting lung expansion and making each breath more effective. However, these compensations are not unlimited. As muscular dystrophy progresses, the chest wall can become stiffer due to changes like scoliosis or tissue fibrosis. These mechanical challenges make breathing more difficult and increase the effort needed. The lungs may also develop issues like fibrosis or partial collapse, which further complicate breathing. Over time, the muscles tire, and breathing can become labored, increasing the risk of fatigue and respiratory failure. Research with animal models, like mice that mimic Duchenne muscular dystrophy, shows that even when diaphragm strength drops, the nervous system can adjust to keep inspiratory pressures stable. This means the brain can increase motor signals to the remaining muscles, helping to preserve breathing function longer than expected. In clinical practice, respiratory therapy plays a vital role. Healthcare providers monitor breathing patterns and watch for sleep-related breathing problems. Non-invasive ventilation, such as nighttime positive pressure support, helps reduce the workload on weakened muscles. Gentle respiratory muscle training may be used to preserve function, but it's carefully tailored to avoid muscle damage. In summary, respiratory muscles in muscular dystrophy compensate through neural adaptations that extend inhalation, recruitment of accessory muscles like the intercostals to support chest expansion, and central nervous system adjustments to optimize muscle effort. Despite these clever strategies, the progressive nature of the disease means that eventually additional support may be needed to keep breathing effective and maintain quality of life. Always consult healthcare professionals for personalized advice and treatment options.